check, check, test, 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 check, check. Check, check, check. Hello, hello.
Hello. Yeah. Sir, let us welcome our eminent gastroenterologist of India, Dr. Naresh Bhat, along with also, please welcome our CMD. Respected CMD, sir, and our very distinguished guest and the eminent gastroenterologists of India, Dr. Naresh Bhat, as well as respected leaders from HR, medical, as well as other divisions and departments, and all the colleagues from our corporate office, and all the employees joining us from factory locations and across India through YouTube stream. So, a very good evening to all of you, sir. On behalf of GTF2 Division and its head office team, warmly welcome to you all to this awareness program organized on the occasion of World Hepatitis Day. As you know that viral hepatitis is a major health concern, particularly because as it remains undetected for a long time. Awareness, timely screening, early diagnosis, and appropriate treatment are therefore extremely important. At Microlabs, the GTF2 division's commitment goes beyond medicines. We have conducted LFT camps, GERD screening programs benefiting more than 15,000 patients, along with digital awareness activities on GERD and hepatobiliary disorder through Facebook, Instagram, and YouTube. We are privileged to have Dr. Naresh Bhat with us today to share his valuable knowledge and insights on viral hepatitis. I sincerely thank to our CMD sir for his gracious presence and continued encouragement. I also thank to our colleagues from HR, Medical Affairs, IT, and the entire GTF2 team for their support in making this program possible. And I'm confident that today's session will deepen our understanding of viral hepatitis and inspire us to become a brand ambassador, responsible ambassadors for this disease awareness. With these words, I request our Senior Vice President, Marketing Medical Services, Dr. Manjula Madam, to formally welcome and introduce our esteemed guest Dr. Naresh Bhat. Thank you.
Thank you, Mr. Subendu. Good afternoon, distinguished guests, respected CMD, our esteemed colleagues who are joined physically here and those who are joined online through our Microlabs YouTube platform, and ladies and gentlemen. We are here today to observe World Hepatitis Day. As all of you know, today worldwide it is observed World Hepatitis Day. Why it is observed? Because viral hepatitis is a silent disease. It means millions of people carry viruses without experiencing any obvious symptom until they get severe liver disease when it is detected. So, you should also understand silence does not mean powerless. One person across the world dies every 30 seconds due to hepatitis-related illness. So therefore, it causes damage. So importance is that it's become a world's most critical public health issue. So yet, modern medicine is there, vaccination is there, where hepatitis B can be prevented, hepatitis C can be cured. So today we have an opportunity, this opportunity of this session to understand the importance of early detection, timely care, and what all of us collectively to do eradicate this menace. So we are indeed privileged to have with us Dr. Naresh Bhat sir. He is a renowned gastroenterologist who will share his expertise and insight on viral hepatitis. He will also tell us how it to be prevented, what are the things to be done for early diagnosis. May I now request our CMT sir to felicitate Dr. Naresh Bhat sir, Mr. Bhuneshwari to help, with sapling as a token of our appreciation. Warm welcome. I request all of you to please stand up, give a standing ovation. Slide, PPT. Okay. Thank you, sir. Now we'll start the session. Dr. Naresh Bhat sir requires no introduction. He is known worldwide, but as a formality, and it's my privilege to do so, to introduce Sir. In this, I have briefed, entirely, really briefed his CV, because if I have to tell everything, the entire session is not possible. So I have just really taken very, very few points from his CV. Sir, Doctor is an eminent DM Gastroenterology, Chief of Gastroenterology at Aster CMI Hospital. He is one of the India's most respected gastroenterologists, and he has clinical experience more than 42 years. As an expert in clinical gastroenterology and advanced endoscopy, he serves as the chairman of Indian NB group as well as core member of the Asian NBI group, and where he actively trains people in advanced endoscopic imaging technique. So he's been training people with advanced endoscopic imaging. He's a president of Society of Endoscopy of India, president-elect of AIGA, governing council member of Indian Society of Gastroenterology, president of ISG Karnataka. So Dr. Bhat has several awards and accolades. That's why, again, I'm just cut short on that. And he's through a meritorious student, gold medal, several gold medals, MBBS, university topper in both MBBS and MD, and topper in gastros. And he has, in fact, 7 university gold medal, and he has delivered some prestigious oration, which includes Dr. Guruswami oration, Dr. K.S. Shadaksharappa oration, and also SCEI oration in 2012. And Sir is an ardent speaker, and he has national and the international publication. Sir, it's an honor with your presence. May I now request you to kindly address the gathering, sir. Over to you, sir.
Good afternoon, all of you. At the outset, I'd like to thank Mr. Dilip Surana and his team here for inviting me this afternoon. Microlabs is not new to me. I've been aware of microlabs since the late 80s, when Professor B.M. Jairam was a mentor of mine, introduced me to late Sri Gevachandji. So I've been watching the initial few steps that microlabs took, and then the giant strides over the last 2 decades under the leadership of Mr. Dilip Surana. And I congratulate all of you for being a part of this organization, which is making such an impact in the Indian pharma business. So today I'm going to spend a little time talking about hepatitis, and as I have seen it, I have been involved in the medical business, if I were to put it so, right from 1974 when I joined medical college. And since then, we've been hearing about hepatitis. So what happened is that there have been a lot of landmark developments over these last 50 odd years. And this business hepatitis is actually a journey of discovery, of trying to find solutions. We've now moved to prevention, and we are on the verge of elimination. So it is a journey that I have seen it in my own lifetime. When this journey began, almost about 50 years ago, we had viral hepatitis at that time, which we called it infective hepatitis and serum hepatitis. Serum hepatitis, as the name suggested, was transmitted through blood and blood products. And then infective hepatitis was waterborne and transmitted through contaminated water and food. We knew very little else. Virology was just, in its early infancy. And our whole knowledge in our textbooks was limited to about 1 page. In that whole book of 2,000 pages, 1 page had something about viral hepatitis. In the exciting 1970s, the hepatitis B virus was recognized, and they identified something what they called the Australia antigen, which they found in some aborigines, in the blood of these aborigines. And it was Professor Barrett Bloomberg who found this, and they said, this is the agent that causes this viral hepatitis, and we can look for it. And so in the 70s, we found a test for hepatitis B, which we now no longer call it Australia antigen, we call it hepatitis B surface antigen. We know that it's not the whole virus, just part of the virus. And indeed, he got a Nobel Prize for this, which just tells you that this was a huge contribution in medicine. Because as you will see, hepatitis B impacts millions of lives worldwide. We also realize that this waterborne virus, which we call infected hepatitis, they gave it a name. They didn't give it someone's name. They said, let's call it hepatitis A, and we'll call this hepatitis B, which is, I think, the most sensible things. Otherwise, we would have a whole lot of people fighting for it, and then we would have an Indian version of hepatitis A given some name, and so on. Fortunately, they called it hepatitis A and hepatitis B, which was very simple. Then they realized that there is something beyond this hepatitis A and hepatitis B. There's another virus. And being so naive, they couldn't even give it a name. They said, it's neither A, neither B. And non-A, non-B was the name of the virus. It's like saying it's not Atri, it is not Shubhendu, it is someone else. They couldn't give it a name, so it's called the non-A, non-B virus. And they found that one of these non-A, non-B was blood-borne, like hepatitis B, and they called it hepatitis C. And one was waterborne, and they called it hepatitis E. So now you had hepatitis A, you had hepatitis B, you had hepatitis C, and we had a hepatitis E. Hepatitis D is a small virus. It is a parasite virus that goes on to people who have hepatitis B, and I don't think we shall discuss this because if you take care of hepatitis B, you can forget hepatitis D. But these are the 5 viruses. We know about these waterborne viruses. We in India ourselves have suffered many epidemics. Just like you have epidemics of cholera, you have epidemics of gastroenteritis, you have huge epidemics of hepatitis A and E. And the number of people who have got affected in the epidemics have been thousands, 50,000, 60,000 people at one time just getting hepatitis. Because it's waterborne, it spreads very quickly and can affect many people at the same time. So while it can be seen, what we call sporadically, it can occur here and there, but we can see large-scale epidemics as well of hepatitis A and E. And can someone tell me what is the easiest way to deal with this, madam? What would you do with a waterborne virus? How would you control it? I make you the mayor of Bangalore. What would you do?
To drink pure water.
Yes, you want clean water supply. But you know how the Karnataka government, they have, what is it? Bangalore Water and Sewage Board. Sometimes they have different pipes for it, sometimes it goes in the same pipe. Right? So this is one of the things that can happen. And that's why you can get these epidemics. And so you have to make sure that if your water source is clean, you can prevent these very easily. Then comes the transmission of hepatitis B and C. We realized that it is called serum hepatitis. That means it's transmitted through blood and blood products. And realized that blood transfusions, when I came here in 1985, we had many blood banks there and no one tested for hepatitis B. So every month we would see at least a dozen patients of who's received a blood transfusion 2-3 months back, and now he's come to us with jaundice, he's got hepatitis B. So we knew that blood transfusions, and of course, anyone over the age of 50 here, except Mrs. Surana? Anyone else? A few, yeah. I don't know, but when I was a kid, if you had a sore throat, you went to your doctor and he gave you an injection. And then he boiled that injection and the needle and he uses someone else. If you went to Bowring Hospital, where I sometimes went when I was a kid, the nurse would have one big syringe full of penicillin. And you went, she put one needle, gave you, pulled out that needle, put another needle, gave to the next guy, and so on and so forth till that whole thing is over. We did not have that concept of disposable syringes and needles. It was the same thing used again, and a lot of times they did not have time to boil it or sterilize it. So through needle stick or through contaminated needles, that was one way this infection was being transmitted. At some time, they realized that you can transmit this infection sexually, like any other sexually transmitted disease, because this virus is there in the cervical secretions of the women or in the semen of men who are infected with hepatitis B. So sexual transmission can occur. But it was not for a long time realized that a bulk of the transmission occurs from mother to child. That's vertical transmission from one generation to another. And that can occur when the baby is in the womb through the placenta, or during childbirth when the baby is in contact with the maternal secretions. So mother to baby transmission actually is the biggest way of transmission of hepatitis B virus. Okay? So you have blood transfusion, needle stick, sexual, but transplacenta. The other thing that we also realized, that if you have a patient who has got hepatitis B, if you screen his rest of his family, there's a 25% chance that someone else will also have hepatitis B. One is that they may have the same mother, or what can happen is horizontal transmission through very close contact in the family. Many lower middle class homes where most of us grew up, we all slept together. 6 cousins slept together. We never had a toothbrush, fortunately, we just brushed with our fingers, but we used the same towel. Such close contact that it was not common for a intrafamilial spread as well. So I'm going to ask this lady on the 3rd row. I like the color green. This. You don't look back. So how will you prevent this vertical transmission? Mother to baby, how will you prevent? No? Okay. Maybe the lady next to her? No? Anyone? Anyone? Yeah, good. Timmy.
Mother needs to be diagnosed first, tested for hepatitis. In case she is carrying the virus, then she needs to be treated
Okay, so what you're trying to say is very good. You say identify, screen all mothers, and if they are hepatitis B positive, treat them so that they don't transmit. Excellent. Can anyone think of a better method to do that? Better method is to immunize all babies. Immunize, vaccinate all babies. Don't bother whether the mother is positive, negative. Give all babies a vaccine. Simpler way. But you're very right. Your reasoning is correct. The other thing is this intrafamilial thing. It's very important that if you have any member in your family who's positive, please get yourself checked. There's a 25% chance that you may be harboring the virus, but you are not aware of it. So two big messages come out from this slide. This is important. What happened when this came into papers, right? When she said she was in SmithKline Beecham. When they brought out the first hepatitis B vaccine, you had all kinds of things going on. Caption said hepatitis B is more contagious than HIV, more dangerous than HIV. Then people were scared, phobia, everyone. This is, oh, that barber shop is where I'm getting the hepatitis B. That fellow is not cleaning the blades. I'm not going to go to a barber shop at all. I'll go to someone in Commercial Street or Brigade Road because it looks more fancy, but it's the same old barber. Then someone says, oh, it's a mosquito. The mosquito bites taking my blood and, getting someone else or his blood coming to me. That's the mosquitoes transmitting. A whole lot of panic in the population in the late 80s and 90s. Everyone was scared. In fact, this is a story I must tell you. A very senior surgeon in Bangalore, very senior surgeon, found out that his daughter-in-law had hepatitis B. She had been married for 5 years, and she had hepatitis B. And so he threw her out of the house. He said, my son is in England. He's not staying here. You picked up hepatitis B, so obviously you're sleeping around with someone who's got hepatitis B. He actually threw her out of the house, and I had to do the counseling for her to go back. So this is the kind of misinformation that had spread in the community. And it took us a lot of effort to try and control this damage and make people, to start thinking rationally that it's not just sexual, there are many more ways that you can pick up hepatitis B. Okay? Now, talking of hepatitis B, there are two things. One is short term, which we medical people like to call it acute, which a lot of people say, acute means severe. No, acute doesn't mean severe. Acute means something that's happened recently, and chronic is long term. We know that you can get, in hepatitis B, you can have symptoms or no symptoms. Even if a lot of people who have hepatitis B don't have symptoms. There are others who have long-term problems which can cause cirrhosis, liver cancer, etc., etc. But what is most important here is this. Babies who get hepatitis B, what happens is that the virus stays in the body. The immune system is not strong enough to destroy it, so they are more likely to get chronic infections. If 100 adults, I actually push the hepatitis B virus into them, right? 90% their body's immunity will fight it, get rid of the virus. 10% will have long-term problems. But it's exactly the opposite in babies. If babies get hepatitis B when they are born from their mothers or whatever, 90% have long-term problems. And that is why it is very crucial for us to prevent hepatitis transmission at birth. So it is more dangerous when babies pick it up. But unfortunately, they have no symptoms. They'll grow up till the age of 25, 30, and then you say, oh, you have hepatitis B. When did you pick it up? Possibly in infancy. So remember that hepatitis B can cause long-term problems, unlike hepatitis A. Hepatitis A, something happens, body gets rid of the virus, everything is over, war is over, finished, peace. But hepatitis B is not like that. It's more like Trump's war, just goes on. And you don't know how long it's going to hit you. Okay? Now, vaccination. The first vaccine came out in 1981. I was doing my first year of MD when this landmark article came out. They actually did this trial on prisoners in the US, right? And they gave them all this plasma-derived thing, and then they found that they developed antibodies and they were protected. 1981. And by 1987, we didn't have to use a plasma-derived, but we had a recombinant vaccine. Right now, our country itself makes this recombinant vaccine as well. And so these are very landmark kind of developments in hepatitis B. Now, to go back into this vaccine story, as I said, initially made from plasma. And what did the US do? They said, no, we should give it only to people who are doctors, nurses, or dialysis patients because they are at risk. They spent 10 years doing that from 1984 to 1994. And they found out that there was hardly any difference in the difference of hepatitis B. The numbers were the same. They realized, like most time, that they may have made a mistake. Americans keep making mistakes. They started even then, they have not stopped even now. So in 1994-95, they found that 10-year use, no impact. On the other hand, the Chinese, they started having plasma factories. Everyone donating blood, deriving plasma, made huge number of amounts of vaccine and started vaccinating everyone. And they found that when they vaccinated children and they followed them up over next 10 years, they found that the liver cancer rates in children had dropped dramatically. Fantastic results, and they showed us that the way to go was vaccinating children and in infancy, and not high risk. Everyone is at risk, so you need to change our policy. And so this was the first vaccine that was recognized as an anti-cancer vaccine. What happened in India? No takers. Initially, no takers at all. Patients said, some another injection, doctor wants to make money, we're not taking. The pharma blitz, as I said, is Smith and Beecham put on advertisements after advertisements. The pediatricians refused to give the vaccine. They refused. They said, no, the vaccine is too expensive. We are not giving it. What's the use? We don't see hepatitis B at all. Till we got a multi-dose vaccine, this which I started, I said, make it cheaper, maybe they'll give. Yet the pediatricians did not relent. Then when it came in the papers, which people started having vaccination campaigns, every mohalla had vaccination campaign, every apartment complex had a vaccination campaign. At that time, the pediatrician said, all the parents are asking questions. What are the answers? I don't know. Naresh, come and take a CME. I had done 10 CMEs and no pediatrician had attended at that time. After this panic, then I found pediatricians started attending CMEs. But it took 10 years to reach that. At that time, in the 90s, we had something called interferon that was used to treat hepatitis B. It came to India, it was very expensive, not very good response either. And this is interferon is normally what the body produces to fight viruses, and this was being marketed to fight the viruses. We had some benefit for the first few years, almost 7-8 years. We used interferon selectively with some benefit. But look what happened 10 years later. We started getting these oral tablets. Started off with something called lamotrigine, and then we have, of course, entecavir, tenofovir, etc., etc. It just changed the management. Interferon got dumped out. Not only was it less efficient, it was injectable, it was oral. Here, we started having general practitioners being able to prescribe this antiviral drug. And this has revolutionized treatment of hepatitis B. But remember, it does not cure hepatitis B. We still have not found a cure for hepatitis B. We still have drugs to control the virus, to make someone virus-free as long as he's taking it. He may not be transmitting it, but it is there. Okay? So, what our biggest weapon that we have is universal vaccination at birth. Sorry, this slide is got distorted. Universal vaccination, this is our strategy. Treat all people who have hepatitis B, that's our next strategy, and prevent complications like liver failure and cancer. And both these can be managed with these tablets. And as I said, universal vaccination. And in fact, the first vaccine that is given after the baby is born on day 1 is a hepatitis B vaccine. Extremely successful program that's gone on both in India and across the world. Coming to hepatitis C, 1989, much after I had finished my gastroenterology training, I was practicing in Bangalore. We found the hepatitis B virus had been cloned. We found a test, a blood test that could screen, that's got anti-HCV antibodies. And then we realized that we had interferon again with some antiviral, which improves outcomes, but not very successful. Where did this hepatitis C, where was a big pool? IV drug abusers. Hepatitis C transmission very high in them. People with sexually transmitted disease, HIV, again a lot of Hep C. It became a major cause of liver cancer and an indication for transplant in the West. So for them, Hep C became a big, big issue. Hepatitis B, they had started, all the blood donors were being screened, they had started vaccination, they had started oral therapies. So hepatitis B was reasonably contained, but Hep C was still a big, big problem. So what do you think changed? Anyone? Let me ask the guys, hardcore marketing guys. What changed? Where's the marketer? There, come on. What do you think changed hepatitis C? Huh? Screening? Screening, how is screening? You find, then what do you do with screening? You don't have much to offer them. HIV research. Research in HIV brought us so much more to the table. We found a lot of antiviral therapy that was available to us. And some of those drugs were introduced as direct-acting antivirals, tablets, which gave us a 90 to 95% cure rates in HCV. So all the research in HIV not only benefited HIV, it benefited hepatitis C as well. So in India, it's actually a game changer. Because the pharma industry in India has a unique thing. It's called a 6-letter alphabet word called Jugaad. We can do anything here. Right? And what was so expensive in the West, we made it possible that it could be easily affordable for the average lower middle class, leave alone middle class. And so we have effective and inexpensive treatment for these, and the treatment is 3 or maximum 6 months. And now a virus that we didn't have a name for, and he called it one of the non-A, non-B, by the time, I finished 25 years in practice, we've been able to not only give it a name, we found a test for it, we found out everything, we found a cure. And now I hardly see hepatitis C, maybe 1 or 2 times a year. So much so that when I get a hepatitis C patient, I have to go back and see what is the dosage of that medicine that we give. I can't remember it because it's so infrequent. So this is a huge kind of achievement, that a virus, from giving it a name to almost eliminating it, has been spectacular. So just to summarize these, hepatitis B was discovered, the HBsAg is identified in 1965. This is much later, almost 30 years later. We have a vaccine for this, no vaccine, therapy, lifelong suppression. So no cure, you have to keep suppressing it. Here, short course cure. Cancer link, both. Chronic liver disease, both. Global burden, look at it, very, very high in hepatitis B, less in hepatitis C. But this is even gone down further because we are now curing hepatitis C. Coming to the last 1 or 2 slides, hepatitis A and E are waterborne diseases. No chronic, no that long-term sequelae, getting cirrhosis, cancer, no. They're like T20. Something will happen, T20 match, it happens, you get jaundice, you get better, 1% may die. So what do you do for strategy, as we were discussing earlier? Clean drinking water, improved hygiene. Hepatitis A vaccine is available. It's considered an optional vaccine in children, but in most urban areas, you find that the children do get hepatitis B vaccine, but it's not absolutely essential. But yes, if you already have a liver disease, you don't want to get hepatitis A, so you can use it in them, because 1 + 1 may make it 4. He may suddenly deteriorate rapidly, so we use it in patients who already have liver disease. Hepatitis E vaccine has just been launched, but like some molecules, we don't know really when to use it. It's launched, but we are not sure which patients actually need to be given the vaccine. So what should you do? Make sure the hepatitis B vaccine is given at birth. Not that you deliver in Kundapur and come 6 months later to Bangalore and get the vaccine. No. If you deliver in Kundapur, you vaccinate in Kundapur. As the lady there said, pregnant women need screening for hepatitis B, very important. So that you can start therapy during pregnancy, decrease the viral levels so that the transmission of hepatitis B to the baby during pregnancy is minimized. Use oral therapies that are available for hepatitis B. Vaccination of hepatitis A vaccine can be given based on your physician's or pediatrician's advice. And of course, avoid contaminated water and unhygienic food to prevent both hepatitis A and E. So hepatitis B, vaccine preventable, controlled but not curable. HCV, first chronic viral infection with a true cure. Our global goal is to eliminate viral hepatitis by 2030. It's not a very long time ahead, but that's something that we can largely achieve. We got rid of smallpox. We almost got rid of polio completely. Now is the time to get rid of viral hepatitis. Thank you.
Thank you very much, sir. It was wonderful. We'll open for question and answer session. So, whoever has a question, please stand up and ask. The mic is available to you. Yes, sir. Mic is there. They have, sir.
Is there, okay, sir? Okay.
Someone from the technical team, please check the questions, maybe there on the portal as well.
We are from Madurai, so almost a third generation now they are giving Ayurvedic medicine. Still a huge crowd, the cost is not, they are not making money, charge only 50 rupees. As a charity they are doing for last 3 generations. Does it work? Or, because I also taken in my childhood. So what do you want to say that?
Interesting question.
3 generations. Still first generation they used to travel a hill place that is near border of
So
Kerala.
simple question, is this Ayurvedic treatment worth it or not? In what lifetime? Now I'm telling you, we are talking about 4 viruses. Which of the viruses are we talking about? Now, Professor Barry Bloomberg actually came to Bangalore and he did some work here. And this traditional herbal therapy that we have in India, Phyllanthus neruri, right? He used that and he found that it had certain antiviral properties. And what did he do? Like all good Americans, he patented it. He says, this is mine. Patent is mine. I don't care what 1,000 generations in Madurai have been doing. This is mine. That's the first thing he did. Then the Indian government, then the ICMR set up a project in the late 80s. A lot of collaborative work, a lot of it from Chennai, where they actually looked at Phyllanthus neruri and did a clinical trial in over 1,000 patients. Spent a lot of money on it. At the end of it, the guy who was actually doing the research is Professor Tyagarajan from Chennai. He found that it didn't work. It made no difference. But ego did not allow us to publish negative studies, unfortunately, because if we put that, then it shows that we are in poor light, that our treatments don't work, so it was never published. But the truth is, yes, it has certain antiviral properties, just like turmeric has anti-cancer properties. But does it work to prevent cancer or treat cancer? It doesn't. Because we need something much more than that. So the brief answer is it doesn't work. It doesn't work.
Yeah. So this is beyond hepatitis. It is said that, all ills start from the gut, and what you eat is what makes your gut. So some light on that, sir.
Okay. Are you all right if we move out from the liver? All right. Now what he's saying is right, because what we have in the gut is a very interesting sort of fact, is that I always say that gastroenterologists are very fortunate because the organs that we deal with have more nerve tissue than the brain, right? More nerves here than in the brain. We have more hormones here than all the body put together. The endocrinologist deals with some 6, different hormones or 10 hormones, but we have many, many more in the gut. And we have an entirely different ecological system inside, which we call the microbiome. Like we have the human genes, we have 100-fold increase in the number of genes, bacterial genes in the gut. We have a whole lot of bacteria, viruses, fungi, all there, all doing various functions. They're not there just as parasites. They're actually modulating your immunity to a big, level. So any changes there actually can make big differences to your immunity. Let me put it in a more simpler context. When Shubhendu comes and praises me, which he always does, you know, maska marna hai is what they say. Alright? Now why does, if someone butters you, why do you feel happy? Or you eat something very tasty, I give him Rasgulla, he's the happiest guy on earth. Why should a Rasgulla make you happy? It's touching your tongue going down. But what happens is there are nerve signals that are going from here to your brain. And the brain is sending nerve signals down. If you get depressed, it affects your immunity. You feel happy, it improves your immunity. Similarly, if your bacteria changes to something which is what we call pro-inflammatory, it can cause ulcerative colitis, it can cause Crohn's disease, it can cause liver disease. So many things can happen. So you're very right that what we eat, what we feed the gut decides what kind of microbiome there is, and the microbiome actually decides what kind of diseases we get. So we are just at the tip of that iceberg, we are just beginning to understand it. Maybe 20, 30 years down the line, we'll have unraveled most of the mysteries, but yes, we are getting there. This is Dr. Jain.
Yeah. Doctor, this is not to do with hepatitis, but again the liver. Just want to know if banana, fruits, coffee, empty stomach, filled stomach, such related things, does it have an impact on the health of the liver?
Good question. Yes, diet does have a role to play as far as liver is concerned. Can anyone tell me which is the biggest problem in India as far as liver is concerned? Biggest? No longer hepatitis B, no longer hepatitis C. Yes, obesity, metabolic syndrome leading to fatty liver. So obviously what you eat will decide that your diet and obesity is a big role. But yes, certain things in the diet are good. Now if our microbiome has to be, what the term we use is diverse. That means a good microbiome can be fueled by a diet rich in fiber, rich in pulses, rich in vegetables, rich in fruits. On the other hand, a diet rich in red meat, lot of ultra-processed foods is bad. So it does make it liver. So just like it affects the gut again influences the liver as well. Coming to specifically, you said banana. I don't think great thing happened with banana, but coffee. Yes, coffee is supposed to be good for the liver. Small amounts, 2 cups, 3 cups of coffee, maybe not a bad idea for the liver.
What about green tea? Green tea?
Green tea, well, there are people who support green tea if you really know what it contains. The problem is green tea is a kind of a universal umbrella term for any decoction. Whatever you put, whether you put tea leaves, you put some other, what is that Korean thing that you put? Ginseng. Or you can use very other kind of herbs. And some of them have been shown to be toxic, cause liver disease. So green tea, you must be specific what you are putting into that green tea. If you say I want to have black tea or decoction, perfectly fine. But if you're putting something which is toxic and you don't know what it is, best is to not take it. If you're one of those who go in the morning for a walk in the park and then come back and take one of those, juices, I don't think you really know what it contains. So that you have to be careful.
So there are ads which are coming now for green tea reduces the obesity of green tea.
No. See, green tea, some green teas are rich in antioxidants. So they may have some benefit. So you can't club all of them in the same way.
Sir, actually I'm from a village background. I don't know whether my parents are given the hepatitis B vaccine. at this age, can we take this vaccine? It will work, or it's only work in the pediatric age group?
Hey, excellent question, excellent question. By and large, adult vaccines, when we vaccinate children, right, the seroconversion, that means it's a successful vaccination in babies is about 95 to 98%. But if I assume that you are 40 years old and I give you the vaccine, the chances that you have a successful vaccination may be 60 to 70%. So you can take the vaccine, but don't sit snugly and say, I have taken the vaccine and protected. You may not be protected. So earlier you take it, the better protection. If you want to check your HBsAg. If you're negative, check your anti-HBs, see if you already have had an infection which has protected you. If you're neither, vaccinate and check your titers. You can measure the amount of antibody to see whether you're protected. So blindly taking, this is what happened when we had that campaign, Mohalla vaccination. Lot of 70-year-olds took the vaccine where the success rate is 30%, 40%. And then they say, no, I got hepatitis B, I got it because of that vaccine. So always adults test before you take the vaccine.
Thank you, sir.
Sir, no.
Doctor, you've been telling, at the beginning you had told us that the virus is there in everyone, but once it surfaces, only then we come to know the severity of it. You said initially, virus is available, already it is there within us, but when it surfaces out, it leads to severity. So, can you please...
Let me correct that. All of us don't have the virus. No. Some of us have the virus.
Okay.
Those of us who are infected have the virus. And in them, it may surface after some time because of reactivation, or when your immunity was down, it suddenly increases, it fights the virus and you get to know about it. So it's not there in everyone.
Okay, fine. And how do you identify, doctor? What are symptoms? Rather than waiting to get into the ICU, what are the symptoms where the person can feel, okay, let me go and get a check done at the initial stage of the symptoms?
Good question. The problem here is symptoms are extremely deceptive. You cannot rely on symptoms. Once symptoms are there, it's like cancer. What do they say? Oh, you may have cancer if you have lost 10 kgs of weight. You may have cancer if your hemoglobin is low. You may have cancer if you have got a lump. Too late. It doesn't help. You need to get yourself checked. And unfortunately, our so-called liver function tests that we do, again, are not very reliable for viral hepatitis. So if you want to get a check for the virus. It's not very expensive. 40 rupees to 80 rupees is an HBsAg test. Hepatitis B. Not expensive. Anti-HCV, maybe 200 rupees. Not very common though. But HBsAg, I would recommend all of you to check it. If you're worried, that's the way to do it. Don't depend on symptoms. Symptoms are late in the game. We'll come to this later because apart from viral hepatitis, what are the other causes of hepatitis? Okay. These are the viruses that I have spoken of, the usual viruses. There are other viruses also which can cause hepatitis. Most important, dengue. Dengue virus causes hepatitis. There are many others. There is the CMV virus, the Coxsackie virus. Many viruses cause. But the important ones are these. Other cause of hepatitis. You put up your hand first. Okay, is alcohol.
No, I want to ask.
Alcohol, for the question, I thought you...
No, this is the question.
The bottle, okay. While alcohol is a big cause of hepatitis. 2 is many drugs. Many drugs can sometimes cause hepatitis because now we are in an age See, now if you use a anti-TB drug, very important. I mean, you can't deny someone, if he's got TB, he needs it. But unfortunately, a small percentage of them can get hepatitis, drug-induced hepatitis. A lot of these Ayurvedic medicines that we use, these teas that you said, decoctions, can cause hepatitis. Some of them are contaminants, some of them are because of it. Or when you put it all together, sometimes a patient is getting 6 medicines, 7 medicines, all which are reacting with each other and leading to hepatitis. So drug-induced hepatitis is a very major cause of hepatitis other than viral as well as alcohol. And there's something which we call autoimmune hepatitis, where the body fights itself, and that also is an important cause of viral hepatitis. You asked this question and then
No, I was supposed to ask on alcoholic hepatitis only, how severe and it is alcohol-induced, like what grade it can go till cirrhosis or it can...
Yeah, good question. Okay, if someone has alcoholic hepatitis, which we define as someone who's been taking alcohol for a reasonable period of time, his liver tests are showing abnormality, right? Not just fatty liver, but his SGOT, SGPT, there's liver cell destruction that is going on. If I take 100 people and I divide them into 3 groups, right? One, I say all of you stop alcohol. In which what happens, 1/3 of them will improve, become normal. 1/3 will not progress, they stay there. 1/3 will worsen irrespective of stopping the alcohol. Which means, please don't try to reach that stage of chronic hepatitis or alcoholic hepatitis. You need to stop much before that. Because even after you stop, it may not change. It may actually worsen. There's some question about H. pylori, infection curable. Yes, it is curable. No doubt about it. Only thing that you have to use the medicines which are appropriate where the bug is not resistant to the medicine. Often we use something which we call bismuth-based, sort of strategies. They work 90% of the time. A lot of antibiotics are resistant, so obviously you don't get good results and all. But unfortunately, we over-treat H. pylori. If I assume that in this hall, 70% of you have H. pylori, do you think it's right for me to give all of you H. pylori treatment if you have no symptoms? Obviously, no. I have to select those patients who have an ulcer or who have a family history of gastric cancer and selectively treat them. Not everyone. It's not necessary to treat everyone. Does this spread? Of course it spreads. Spreads from close contact, from, say, kissing. You keep kissing your baby 10 times a day, you have H. pylori, you may transmit it. There are different ways, very close contact through oral secretions, you can spread H. pylori. That's all?
Complete, no?
Thank you very much, sir. I call upon... It was very insightful, made it so simple, very interesting, wonderful, sir. We have really had a very nice session. I call upon Mr. Praveen Singh to give the vote of thanks.
Thank you, ma'am. It's my privilege to deliver the vote of thanks. First and foremost, I express my sincere gratitude to Naresh Bhat sir for accepting this request and also for taking time out. And we know how busy sir is. And today being a hepatitis day, we know how much he has been in demand from so many other companies and others. Sir, thank you very much for accepting and taking it. Thank you. Thank you so much, sir. We are honored. Thank you. Thank you, sir. Thank you. And of course, I would like to thank respected CMD, sir, for, these kind of employee welfare activities, we never get a regret from sir. Sir, thank you very much, sir, for permitting this event. And I thank our SBU head, Mr. Shubhendu, for driving us to excel and also checking at every point and improving upon what better we can do. And thank you, sir. Thank you very much. And a special word of appreciation goes to my team of Ms. Devlina, Ms. Varalakshmi, Mr. Vazil, Mr. Vasant sir, and Mr. Bhushan for conceptualizing and executing this event flawlessly. And an event like this cannot be conducted without the support and guidance of the medical team. Ma'am, thank you very much for hand-holding and guiding and inspiring us to conduct such programs. Then a special thanks to, this event would not be possible without the support of the HR led by Mr. V.R. Ramakrishna. I'm sure Ramakrishna sir is watching from Pondicherry, which was his assignment today. The entire factory is watching, I guess. And of course, the ever available and then go-getter and who will ensure that things happen in place, including the chairs are kept in the right place, in the right direction. Ms. Bhuvaneshwari, please give Bhuvaneshwari a very big hand. And of course, without purchase order, without any of these things, this cannot happen. Rameshji, thank you so much. And I just want to tell the dedication from our team. Rameshji was here at 8:30. Bhuvaneshwari was here at 8 o'clock. Right? This shows that, the kind of love and passion what they have for the organization and also for the event like this. And finally, I thank each and everyone for coming over here. And I see a lot of SBO heads. Thank you very much for sparing your time when we are on pretty close to the sales closing. And thank you so much. And thank you very much all. Thank you very much. Thank you very much.
Thank you.